May is National Stroke Awareness Month. Now, as a gynecologist, you may be thinking, well, why does she care about stroke? Turns out that I end up discussing stroke a lot with my patients. And here's why. As a gynecologist, I deal with estrogen, which is a major hormone in the female body, and we give estrogen in many of the medications that we use. So estrogen can actually cause blood to clot. And in the setting of other risk factors such as diabetes or high blood pressure, obesity, or cigarette smoking, plus estrogen, we can actually increase our risk of clots and stroke. So if you are a woman who is taking estrogen containing products, what does this mean for you? So as a gynecologist, here is where I discuss stroke with my patients. So number one, birth control pills. Birth control pills have estrogen in them, most of them. There are some progesterone containing pills only, but the average birth control pill has estrogen. So if you are a patient who is smoking or obese or also has uncontrolled diabetes or high blood pressure, when we talk about giving you the generic birth control pill, we discuss stroke because this can increase your risk of stroke. Now, this is very, very tiny, very, very rare, but it can happen. So you want to control all of those other risk factors. Number two, hormone replacement therapy. When women are undergoing menopause, it's actually called menopause hormone therapy now. We discuss, replacing some of those hormones with estrogens and progesterones via a patch, a pill, a ring. And this is one of the risk factors that I talk about. It can very, very slightly increase your risk of stroke. Again, tiny. But if you already are somebody who has risk factors such as uncontrolled diabetes, blood pressure, smoking, or morbid obesity, this can actually come to play a role. And number three, a history of clotting disorders. Now, many women don't know that they have a family history of clotting disorders and that they may actually have one as well. And so if you've heard of somebody in your family say, oh, your grandfather or your uncle or grandmother or whoever, had a clot in their lung and they died from it. Well, this should make you probe a little bit further. And this is something you definitely want to mention to your gynecologist. There's testing that we can do to see if you have a clotting disorder. And if your blood already clots a lot, then we do not want to be giving you estrogen because that can increase your risk of stroke. So hopefully this has helped you put estrogen and G1 health in the big setting of stroke and learn more about your risk factors.